Psoriasis. Introduction. In psoriasis, the silvery scales are layers of skin.
Select true or false. Correct. Scaling happens when cells on the outer layer of the skin reproduce faster than normal and pile up on the skin's surface.
Stress and other infectious diseases can cause psoriasis to flare up.
Select true or false.
Correct. Conditions that may cause flare-ups include changes in climate, infection, stress, and dry skin. All skin patches that have lesions with a reddened base are forms of psoriasis.
Select true or false. Correct. Psoriasis can look like other skin diseases. That is why the healthcare provider may have a skin sample examined under a microscope for a definite diagnosis. To treat psoriasis, healthcare providers usually start with topical treatment. Select true or false. Correct. Healthcare providers usually start with topical treatment. If it does not work, they may try phototherapy, then systemic treatments.
Sunlight can clear psoriasis for some people.
Select true or false.
Correct. Daily, regular, short doses of sunlight that do not produce a sunburn clear psoriasis in many people. Phototherapy uses ultraviolet rays.
Select true or false.
Correct. The purpose of phototherapy is to expose the skin to ultraviolet rays to kill the T cells in the skin responsible for psoriasis. Only medications that suppress the immune system have side effects.
Select true or false. Correct. Most medications have side effects. Make sure to discuss the benefits and side effects of any medicine you take with your healthcare provider and pharmacist. Thank you for using Explain.